Hi, this is Jessica DeMassa, and I'm here with Dan Burton. He is the CEO of Health Catalyst. So Dan, welcome. Tell me a little bit about Health Catalyst.
Well, thanks for having me. Health Catalyst does three things for its health system partners. First, we offer a data platform. So we're really good at bringing data from hundreds of different sources into a single source of truth that then health systems can use to do the second thing that we help them with, which is analyze that data at the apps layer and pinpoint opportunities for improvement. So we have a few apps that we've built, and then we enable our clients to build their own apps, or we enable an ecosystem of other apps providers to use the data in the data platform to pinpoint opportunities for improvement. And the last thing that we do is we bring in services expertise to help actually execute against those projects when we find there's an opportunity for improvement. So those are the three things we do.
Tell me a little bit about some of the clients that you have, because I understand you work with some really big health systems, some big names.
We do. So we've been fortunate over the 10 years that the company's been in existence to work with a lot of providers across the whole healthcare delivery ecosystem. And over the last couple of years, we've also added some payers. So on the provider side, we work with some of the largest providers in the country, like Kaiser and Partners Healthcare in Boston and Stanford and UPMC. But we also work with small rural hospitals in the southeast and every region of the country. We work with academic medical centers. We work with really across that healthcare delivery ecosystem. And then over the last couple of years, we've added some payer clients as well.
Give me a little bit, I guess, from a macro view.
Yeah.
You know, what are some of the big trends that you're seeing in terms of health analytics and some of the things that, like, I guess some of these bigger health systems are looking to gain in terms of efficiencies?
Well, I think as the payment model starts to shift for these health systems from a fee-for-service model to more of a fixed per member per month, fee-for-value type model, all of a sudden now cost becomes really important to understand. And cost avoidance becomes important when, we might be inefficient. And so the use of data to actually pinpoint, first of all, what are our costs, and secondly, where do we veer from best practices so that we could improve and in that way bend our cost curve in a positive direction. That's not something that the healthcare industry has really done a lot of.
Right.
So that's a big trend, I think, over the next 5 to 10 years will be these providers needing to understand at a very granular level what their cost structure looks like and use data and analytics to pinpoint areas for improvement.
Have you been surprised at anything you found when you've looked at the cost structure where you're like, oh my God, I had no idea that this was costing this?
Oh, there are all kinds of surprises. So I think the biggest surprise for me, so in my career, I spent the first couple of years of my career a couple of decades ago in healthcare, and then I spent quite a bit of time outside of healthcare. But coming back into healthcare, the biggest surprise for me was that most health systems really don't have a sense for what it costs if I go get a knee replacement. There's no data, there's not enough data to actually know what it costs for my knee replacement versus your knee replacement. So that's the biggest huge gap. This is really the only industry, I think, on the planet where
nobody knows
we
what anything costs.
don't actually know that. So what we found with some of our forward-looking clients, like UPMC, we actually co-developed a precise costing solution with them, and now they're using that to pinpoint some huge variation. That means there's a great opportunity for improvement as we standardize on the best way to perform a knee replacement surgery, for example. Instead of there being such a wide range of, on the one end it might cost $2,000, on the other end it might cost $20,000. You tighten that range and you realize better outcomes for the knee replacement patient and significantly reduced overall cost.
What do you think we really need in the industry to achieve true cost transparency?
Well, first you need data. So one of the big challenges is we actually don't collect all the data that you would need to pinpoint at a precise level how much it costs for my knee replacement surgery.
They don't collect that?
No, there are a lot of gaps.
Okay.
So if you think about at a granular level, what would I need to know? Well, I'd need to know exactly how much time the surgery took, who was involved, what kind of post-operative care happened, and who came into the hospital room and for how long, and for exactly how much time was everyone involved to get that precise level of costing.
Yeah.
And in a lot of cases, we are not actually collecting that data. So the first step is collect the data. The second step is be able to use that data to actually pinpoint areas where it matters. So you got to apply the Pareto principle as well, because it can be very expensive to collect all that data. So are there ways through technology where we can collect that data in a more automated way,
Right.
and then use good applications that analyze and pinpoint the opportunities for improvement. So that's a lot of what we focus on.
Okay. Last question for you, and we've been asking everybody this. So we've been asking everybody about their WTF health moment, which means, what's the future health? Like, things are so bad right now, right? And everybody's got their own separate story of what's wrong. But for you, I guess, what's the future? Like, what's the future for data analytics? Like, where is this going to take us, and how is it going to make things better?
Well, I see incredible promise in using data and analytics to totally change the future of healthcare. I think if you look at the history of the healthcare ecosystem, up until maybe 5 years ago, most of the data about us as patients was paper-based. So we really didn't have an opportunity to harness the power of data like other industries have. But now, 80 to 90% of the personal medical records are now digitized. And so there is this incredible opportunity to start harnessing that data. And we see it thousands of times as we work with our clients, that is the transformational power. It's the power of data to start doing the hard work of pinpointing where we need to improve, and then getting after it. So I feel optimistic. There's a ton of work ahead, but now we have data. We have the ability to use that data to pinpoint what we should work on first and how we fix things.
Awesome. Well, Dan, thank you so much for your time and for sharing your perspective. It's lovely to speak with you.
Likewise.
Thanks so much. Thanks. This is Jessica DeMassa with Dan Burton. Thank you.